Glaucoma Part 2. Let us start with definition of glaucoma. Glaucoma is not a single disease process but a group of disorders characterized by progressive optic neuropathy resulting in characteristic of the optic disc and a specific pattern of irreversible visual field defects that are associated with intraocular pressure. Consequently, the term ocular tension is used for cases having constant raised intraocular pressure without any associated glaucomatous damage. Conversely, the term normal or low tension glaucoma is used for typical cupping of the disc or visual field defects associated with normal or low IOP. So, in glaucoma, there is progressive optic disc changes which can be measured, or these disc changes can be seen using fundoscopy and ophthalmoscopy. Mainly ophthalmoscope is used, and if we see optic disc changes, we can see cupping of the optic disc. Visual field changes are measured using perimetry, and these are irreversible. Intraocular pressure may or may not be raised, and it is measured using tonometry. The classification of glaucoma, there are three types: congenital, primary, and secondary. Congenital developmental glaucoma. Primary congenital or developmental glaucoma without associated anomalies and with associated anomalies. Primary adult glaucoma. It is of primary open angle glaucoma, primary closed angle, and mixed. Secondary glaucoma. Secondary open angle glaucoma, secondary angle closure glaucoma. Now we are discussing congenital glaucomas. Congenital glaucomas are a group of diverse disorders in which abnormal high intraocular pressure results due to developmental abnormalities of the angle of anterior chamber obstructing the drainage of aqueous fluid. Primary congenital or developmental glaucoma is of three types: newborn glaucoma or true congenital glaucoma, infantile glaucoma, and juvenile glaucoma. Newborn glaucoma or true congenital glaucoma is when IOP is raised during intrauterine life and child is born with ocular enlargement. Infantile glaucoma is when, if the disease manifests prior the child's third birthday, and juvenile glaucoma is when IOP raised after 3 years of the child birthday but before adulthood. And it is associated with autosomal dominant inheritance. Some of the families suffering from POAG, primary open angle glaucoma, have a genetic anomaly on long arm of chromosome 21. And now let us discuss about buphthalmus. Buphthalmus means bull-like eye. It is also a congenital glaucoma condition. The disease manifests prior to the age of 3 years and eyeball enlarges, and so is the term buphthalmos. Pathogenesis. Maldevelopment from neural crest derived cells is responsible for impaired aqueous outflow resulting in raised IOP. Due to this, iridotrabecular junction maldevelopment occurs. Trabeculodysgenesis occurs, because of which flat or concave iris inserted into trabeculum. Because of this, accumulation of fluid occurs and thus buphthalmus occurs. Classic triad of buphthalmus. Lacrimation, photophobia, blepharospasm. Blepharospasm means involuntary closure of eyelid. Corneal signs include edema, enlargement, Descemet's breaks in Descemet's membrane, hazy cornea with frosted glass appearance, sclera becomes thin and appears blue due to underlying uveal tissue. Anterior chamber becomes deep, iris iridodonesis and atrophic patches, vibrating movement of iris due to subluxation. Lens become anteroposteriorly flat, optic disc cupping atrophy. Axial myopia may occur because of increase in axial length, IOP raised buphthalmus. Examination is done under general anesthesia. Measurement of IOP is done using Perkins applanation tonometer or tonopen. Using the above device, we can know the pressure inside the eyeball by applying force from outside. This is the physics beside that involves beside the instrument, and Perkins applanation tonometer picture is given, and then measurement of corneal diameter by calipers. Slit lamp examination for examination of anterior chamber and retina. Ophthalmoscopy to evaluate optic disc. Ophthalmoscope picture is given, and gonioscopic examination of angle of anterior chamber. The picture of examination of optic disc is given. Slit lamp examination picture is given, and so typically a child who is having buphthalmus present with blue eyes, as we discussed, sclera becomes thin and blue with blue eyes and blue bull-like eyes, enlarged eyes. Cornea is enlarged. Like this, a child with buphthalmus present ophthalmology OPD.